Hello, welcome to our November Community of Practice for SPDEG's MTSS. I'm Wendy Hardwick, a MTSS specialist with the SPDEG grant at the OSDE. Today we are talking about assessments in MTSS, and we are happy to welcome Chase Kitterman. He is a PhD student in school psychology, and he is the training and consulting manager for the Bridge Center at OSU. The Bridge Center is there to provide educational institutions an integrated evidence-based model for meeting the academic, behavioral, and mental health needs of students through interactive training that is appropriate and also appropriate technical assistance and applied research. Thank you for joining us today, Chase, and welcome.
Thank you very much, Wendy, for the nice introduction. It's nice to see everybody today. Benjamin, it's always nice to get to see you. Just gonna tell everybody my fear. The last time I did a community of practice, I didn't realize that my screen wasn't sharing, and I talked for a good 35 minutes until we found out. So I'm gonna hopefully avoid that today. So just give me a moment and I'll share my screen. Here we go. All right. So hopefully everybody is able to see my presentation come up. I cannot see anybody right now. Benjamin, Wendy, can one of you confirm that I'm sharing right now?
You
You
are
are indeed sharing.
diagnostic assessments.
Excellent. Thank you so much. So we're going to get started today, and a lot of what we're going to focus on is about this topic of diagnostic assessment. We're talking about how to do this within an MTSS framework. So again, I'm Chase Kitterman. So I am a doctoral student right now, but I'm also a nationally certified school psychologist. So I'm actually in graduate school for the second time, which do not recommend unless you really want to do it. So just a little bit about me before we get started, because I know some people are jumping on. I've lived and worked in a number of different places. So my background is psychology and school psychology. I completed my bachelor's at Kansas State University, go Cats, in psychology. And then my way back to Oklahoma, where I'm originally from. I did some systems consultation work with the Osage County Interlocal Cooperative in the Pawhuska Hominy area for a number of years. It's where I did my internship as a school psychologist. And then I made my way working for places like the Devereaux Center for Effective Schools in Pennsylvania, a private practice clinic called Daily Behavioral Health in Ohio. I spent some time working as a school psychologist in schools at Whitefield School District in Colorado Springs before making the really awful circle all the way back to come back to Oklahoma, where I have the fortunate opportunity to work with the OSU Bridge Center and help work with a lot of rural school districts and helping them implement MTSS. And I always forget to share the fun things about me. On the left-hand side, a couple pictures. My wife and I got married in Ireland, and that's a picture of us with a couple of our best friends from the UK, kind of celebrating. And then below is me and my wife and our two dogs hiking in Colorado. So always a fun time. Not quite able to hike like I could in Colorado, but Oklahoma is still really scenic, really fun place to be. So here are some objectives for the presentation I'm going to go through today, and really three big areas that I want to hit with everybody. I want to establish the role of diagnostic assessment within a problem-solving model. So there's multiple forms of data and multiple questions to be answered, especially when working with students, groups, or individuals, and understanding how this all fits. I'm also going to talk about how diagnostic assessment can help lead into that conversation about intervention selection, and then do a brief kind of application of showing how this applies using more of an academics example kind of towards the end. So one thing to point out is everything that's talked about kind of falls within this OKMTSS framework for our state and navigating how we're supporting students either at a building level or a district level, all the way down to individual students with like the tier 3 tertiary intervention. Today, we're kind of focusing in on two areas. One is going to be from that data-driven decisions column, talking about those data decision rules and sources of data for identifying and selecting practices. And a lot of these initial conversations about diagnostic assessment are really good to have when we're trying to build capacity for tier 2, or those more targeted interventions. All right, so segueing in. First, we're going to do some kind of pre-work. We're going to talk about data-driven decisions and just problem solving in general, especially within MTSS. So I'm talking about problem solving. I'm really talking about leveraging and using data. So sometimes that can be about identifying initial needs as where a school, team, or a building focuses their efforts, the level of implementation of how they're putting things into place, whether we're talking about a targeted small group intervention or more intensive supports. And then always keeping in mind when we're making the decisions as a group, as a team, always focusing on student outcomes. Are we actually achieving valued outcomes like increased academic performance or engaging in pro-social behavior and improving school climate in our buildings? Always keeping that as a center driving force in what we're doing. So at OSU Bridge Center, we do ascribe to a 5-step problem solving model, and that'll be what I kind of talk about in context with this conversation today. So kind of pivotal to that is we're always collecting and using data. So I myself really love data. I'm a huge data nerd, and I'll kind of talk about what I mean about it in this model. So these are the steps, and I won't go too much in depth with this because we're really going to focus on step 2 today. So we have these different steps to problem solving where we have different forms of data and information to help drive a conversation. So step 1 is problem identification. We're really asking that guiding question, is there a problem that we need to address as a team that we need to utilize our time and resources for? That's going to come from screening and early indicator data. So thinking of things like AMIRA, NWEA, Acadience, office discipline referrals, expulsion suspension rates, those might be those indicators to say, hey, something might need a bit of our attention, but that's not quite where we want to be. And we have to go to problem analysis, really defining like what is that problem going on. That's where we get into today's topic of diagnostic assessment and multiple sources of data. I'll quickly just kind of give a preview that we're not done once we find out what the problem is. We need to make sure to have productive conversations in developing a plan, establishing a baseline, making sure we're following through with that plan through having a plan for collecting fidelity data, and then evaluating if something is working. And that's where we get more into that conversation of progress monitoring for academics, behavior, and mental health. So like I said, today we're kind of zoned in on problem analysis, really identifying what is the problem in this conversation. So the key thought behind this step is really just defining the problem clearly. If you take nothing else away from this community of practice today, it's that poorly defined problems are difficult, if not impossible to solve. Some good guiding questions to think of are the who, what, when, where, and why for a problem to develop what's called a precise problem solving statement. A way to think about this in kind of a non-academic related way is we're getting into that time of year where it's starting to get cold. Some of you might be getting some notices if you rent an apartment, like, hey, drip your sinks. You might notice that your sink is leaking. Words. Your sink is leaking. When that happens, we don't immediately call a plumber, rip out all the plumbing and go through all the pipes. Sometimes we have to get a little bit more information to really identify what the problem is. Because sometimes it's as simple as like the faucet is loose and needs to be tightened, where sometimes it might be a larger issue like a pipe rupture or burst. So we're using that same logic to talk about academic skills and behavior within a problem-solving process. Some key things that you might be looking for when we're doing problem analysis include leveraging those screening tools, looking at things like office discipline referrals, or for mental health like counseling, teacher, staff referrals, or even self-report, academic skills tests, teacher input, and then other forms of information like school nurses visits can sometimes be helpful information to incorporate. So it's not just a like one size fits all approach. There's going to be a lot of information, some formal, some informal, that you leverage in these conversations. So that kind of brings us to the main topic. So we kind of did a setting the stage for talking about diagnostic assessment. And a lot of the times when we're here, it is literally that Houston, we have a problem. We know something is going on, whether that's from our screening data that's going on or tracking those discipline referrals. And we really have to understand what is the underlying cause, whether it's for this group of students, this small group of students, or a classroom. So we talk about diagnostic assessments. What exactly are they? If you're able to see or saw me when I introduced myself, you'll see that I have glasses. So again, we're using that same logic where when you go in to see somebody like an optometrist, you might do an initial screening. You might be asked to close each eye and kind of read the letters across the board until you hit where you just can't read anymore. That's the equivalent of like DIBBLS or NWEA. That's the broad screening. That might indicate that there's some problem. On the left, you'll see that machine that they use when they say, like, is it better? Is it worse? Is it better? Is it worse? That's the actual diagnostic assessment. That is how they determine what your actual prescription is. You can't get that information just from the screening alone. And on the right-hand side is an example for hearing. So some people get hearing screening, and then thinking about like newborn babies, they all go through a hearing screening. And if you fail that screening, you might have to do something like an audiogram to figure out what range of decibel you can and cannot hear. And that might help if you need like hearing aids or need some other form of treatment. Again, we don't get that from the initial screening. We have to collect more information about where we are at, what skills we do or do not have, and what needs to be the next step for treatment or intervention within a school. So by definition, diagnostic assessment is really pretty open. It's additional data that's collected or analyzed to identify target for intervention. And again, like I said, this can be formal or it can be informal. So formal things might be doing like a drill down of really discrete academic skills like phonics skills, where informal might be talking with a teacher, talking with a school nurse, and trying to figure out what's going on with a situation where somebody's having some internalizing difficulties. The overall purpose, though, stays the same. So diagnostic assessment helps provide data to identify target areas for intervention, and this can be done with individual students or even at group levels, whether we're talking about a small group, talking about a classroom, or even talking about a grade level. The purpose is to help assist teams in appropriately planning and selecting interventions. Again, that precise problem statement is really that key piece to being able to have a well-matched intervention. On the screen, there's a lot of different examples of diagnostic data sources. So this is not, again, like something that you'll have complete total knowledge of, like a complete inventory of all possible options. But here's just a couple things you can keep in mind. You might have some of these available to you already, especially academics. You might have a reading specialist that has phonics inventories or other ways of tracking things like oral reading fluency. But you can also leverage different assessments like a can't do, won't do, which is something that I'll talk about in a little bit. And I do apologize, I do have dogs at home, so if you catch any barking on my mic, I apologize for that. On the behavior and mental health side, we might be looking at things like office discipline referrals, patterns of attendance, more of those informal teacher and student interviews. We might have a social behavioral screener like SABRS or the early identification system to look at. And can't do, won't do assessment, if you notice, actually applies to both academic and behavior mental health skills. All right, so setting the stage before we do these examples, if you're thinking about diagnostic assessment, we talk about diagnosis in this term. Diagnostic assessment is looking at skill deficits and seeing where somebody is at instructionally to match that intervention. That is not the same as diagnosing a disorder like a neurodevelopmental disorder like autism, or categorizing somebody for a disability category like specific learning disability. Diagnostic assessment is just a means to get more information to help develop those precise problem statements for intervention selection. So they are not the same, not equal. To give a little bit of an example of skill diagnostics, some of you might be familiar with Amira as a platform. This is just an example of a printout of a class progress report where it just kind of gives an overview of who is at or above a benchmark, who is kind of developing skills on track, or might need some more support. What you might notice when you see these kind of initial reports, that might not give us all the information we need to really figure out a well-matched intervention. These initial composites are really good about separating who does have these initial skills, who doesn't, but they don't tell us what skill to intervene on. That's where we might have to dig a little bit deeper. An example on Amira is they have breakdowns by the actual discrete skills that they were looking at, like word recognition, comprehension skills, and then fluency for reading. This is going to give us a lot better idea of where this problem stems for providing support. So you'll notice some of the students in that yellow developing range, they're going to need a different approach most likely for intervention compared to those at the very bottom who appear to be missing a lot of skills in the area of literacy. Those students that are in that on-track developing range, that are in that yellow, might be good to work on with word recognition or comprehension together, but that's not necessarily going to be a good fit for those bottom three students. That's where we might have to actually find additional forms of data to collect, especially related to like phonics skills and reading. This is an example of the core phonics survey. So it's a record form that has accompanying assessments to look at things like alphabet skills, really early reading and decoding skills, because that's what students might need sometimes with academic skill problems. So a fourth grade, fifth grade, sixth grade student who really is not performing close to where their peers are on these broad composites and these skills, they might have to have additional assessment that goes way back because you want to try to target the skill that somebody is at that instructional level on. You don't want to keep trying to hammer fourth, fifth grade reading comprehension to somebody who has basic short vowel CVC word problems. You want to address that skill really finely. And this is a lot of academic information, but this concept also applies to behavior. So these are some examples of office discipline referrals that have been broken down by different categories. So we might have some additional thresholds of say, hey, we have a lot of referrals that are happening in our building right now. Let's take a deeper look at what's happening. When you look at referrals this way, you can say, hey, second and fourth grade are kind of highlighted with more referrals than some of the others. It's happening in the classroom and the playground, a lot of aggressive behavior, and really it's kind of in that late morning, early afternoon. That is a lot easier to develop, that precise problem statement to think about for a plan compared to, hey, we got a lot of referrals. So helpful ways to kind of think about this process and how it can be both formal, like the core phonics survey, or informal, looking at some of this data by different metrics like location, time of day, and problem behavior. So then kind of leading up to this is an example of how exactly do you use diagnostic assessment data? So we can collect it really well. Schools often have like a number of different ways and different platforms that they can use, like intervention platforms that collect data from screening and give intervention recommendations. But sometimes we might have to have those additional pieces, especially when we have those academic and behavior skill problems that kind of come together. Because even though it happens sometimes, usually a lot of problems are a combined issue of academics and behavior skill difficulties. They're not just one or the other, which comes with its own degree of difficulty for teams. So again, grounding ourselves in that problem solving model, we're going to talk really just about those first two steps, problem identification and problem analysis. So we didn't talk about the key points for identification before, but just so you know what they are, it's just identifying if there is a general problem and whether that expectation kind of meets somewhere with reality of the situation going on for a student. So the context of what's going on. And then again, those key thoughts for problem analysis, just getting that defined problem, answering those questions like who, what, when, where, and why for why problems occurring in the school for academics, behavior, mental health. So now we're going to talk about an example framework for how to analyze data and link it to interventions and planning. So I mentioned before, when we talked about those forms of diagnostic assessment, a can't do, won't do assessment. That's the like school-friendly name for what's generally called a skill versus performance assessment. These are just some general steps of what this looks like. I won't read each one line by line, but basically you're seeing like an initial screening of a skill. This can be like simple reading skills, sight words, it can be comprehension of a reading passage, and you get their baseline. You get where they're at right now, no incentive, no anything, just kind of saying, hey, like please do this, and then we'll track to see where you're at. You then offer some type of incentive or reward if they can have increased performance on whatever that task was. You do it again, and then you look at the results. And I know it sounds super, super easy, but it's super beneficial to help answer whether somebody falls into one of these three areas. So when you do skill versus performance assessment, you can really gauge whether something is a skill deficit That's going to be when somebody's unable to perform the task. So that's a teaching problem. That's different than a performance problem, which is a performance deficit. This might be where somebody knows how to do something, they've mastered a skill, but something in the environment is not making it that effective or efficient to do. So they might be relying on a skill that they learned in the past for like math and addition, subtraction that is just way less efficient, but it's easier for them to do. They're more motivated to do that over what they're being taught currently. And something to keep in mind, especially in those early grade years, performance deficits end up leading to skill deficits. So you think about early literacy and phonics skills and basic numeracy skills. If those start off as performance deficits and then it becomes aversive, by the time we're in fourth, fifth, sixth grade, we not only have less motivation to do something, but then we lose out on that skill. We don't have that caught up the same way we do with our peers. And that's when we get into those combination problems. And that's when somebody might perform better when incentive is provided and that can't do, won't do, but they're still well below where we would expect them to be in that skill. And that is going to be those times where we have to address both the academic skill deficit and those environmental contingencies to help motivate them to do that appropriate behavior or engage in that task. And with skill versus performance assessment, just kind of an overview, like really briefly if you need it on a slide. Can't do problems, the focus is really that teaching piece. Won't do problems are reinforcement strategies. And then a combination problem is, of course, using both of those strategies together. A little bit more comprehensive of a plan because it's a more complex problem. I'll also briefly talk about this concept called the instructional hierarchy. So the instructional hierarchy is a learning model that breaks learning into a bottom-up process where we start with basic acquisition or accuracy of skills. We then move towards fluency, generalization, and adaptation. And this is generally how we conceptualize and talk about those early academic skills, especially with things like literacy skills, numeracy skills. So with the instructional hierarchy, just brief overview, acquisition is again that initial developing and learning of a skill. This also includes things like coping skills for mental health strategies for dealing with things like emotional dysregulation or anxiety. We have to first teach somebody the base skill. We don't expect them to just use it 100% of the time in all situations and circumstances just off the first try. We then work from acquisition or accuracy into that fluency, that automaticity, being able to do things quickly so we don't have to spend a whole lot of time thinking about what we're going to do. We've learned it well enough and know how to do it that we're just going to do it well and we're going to do it quickly. Fluency, a lot of the time, is that linchpin to moving on to more complicated tasks. Think about that time you were in high school or in college if you took a course like algebra or calculus. Imagine being very, very slow but accurate with base multiplication, division, and addition, subtraction. It would take you far longer to try to do those more complex problems, like in algebra, if you don't have fluency in those initial skills. Then we have generalization, where we might not be applying the skills that we're fluent with in different circumstances. So an example, a student might fluently read grade level material from a textbook, but they have difficulty reading fluently on a standardized assessment. And we can actually program and support people to be able to generalize tasks over time. Finally, in the hierarchy, we have adaptation. That's where like everybody wants everybody to be by the end. So students might have difficulty applying skills to more difficult higher order problems, but generally in schools, we're really focused on accuracy, fluency, and generalization problems. What this might look like, especially academically, an accuracy problem, we're going to have a high number of errors and we're going to be slow. We might then focus our approach solely to teaching skills. A fluency problem is going to be that middle where we're not really having a whole lot of errors, especially when we're talking about like reading fluency, but we're just going to be very slow at it. We're not going to be able to meet that demand like other peers can. And that's where we might have to focus on goal setting and then reinforcing reading faster, more fluently over time. A generalization error issue is going to have low errors, high fluency, But when a new situation comes up, they're not going to be able to kind of pivot and adapt to that. So they might be used to reading like a single passage very quickly, very fluently with little errors. But then when you ask them to read like a novel or a chapter book, then we might have some issues generalizing. And that's where we're going to have to focus on teaching and reinforcing in those different contexts to promote opportunities to generalize those skills that we're teaching, especially if they're being taught kind of in isolation or with a reading specialist or in small groups. So then putting all these pieces together, thinking about our approach to diagnostic assessment, the problem solving model, instructional hierarchy, and can't do, won't do assessment, here's how we kind of start to finish this process. So again, step one of the problem solving model, is there a problem? If the answer is no, we celebrate. We don't have to take the time, energy to meet as a team. What's being done is effective, especially for those students that are at benchmark. They just keep continuing on with curriculum as intended and gaining those skills. But if there is a problem, then we get into that conversation of diagnostic assessment. Do we need to collect additional data? If it's no, which sometimes, a lot of times not really the case because we need to have that precise problem statement, we might sometimes be able to develop a brief plan, but more often than not, we're going to have some additional data. And that might be a starting point where we try to answer that question, is this a skill problem or a performance problem? And we assess that through that can't do, won't do assessment. If it's a can't do, that lets us know we need to go a little bit further, might need some more information to figure out where they're at in that instructional hierarchy. Do we need to help them with accuracy, fluency, or generalization? If it's a won't do problem, they already have the skill. That's where we need to start thinking about functions of behavior, which I could go off on a completely different community of practice another time and talk about for hours on end, but really setting up the environmental contingencies that give potential reward to help reinforce appropriate academic behavioral skills or utilizing those healthy mental health strategies for coping. And again, sometimes we have both. Academics, behavior, and mental health can all be intertwined and messy sometimes. So that's where we might have to leverage the instructional hierarchy, talk about those functions of behavior, and really have a really integrated plan. And the best plans often have 4 elements. Again, I could go into complete other conversations about this, but something to keep in mind when you're thinking about academic behavior intervention. Does that process include prevention strategies, discrete teaching strategies when it's needed and it's not just a won't do? How we're going to reinforce continued engagement in those academic, behavior, and mental health pro-social skills, and then how we're going to respond. So academics, this can be how we respond to errors, like with an error correction procedure, or if it's more of a behavioral issue, if we're going to do something like planned ignoring so that every adult is on the same page of what happens when a problem behavior occurs. So keeping that in mind for just that overall plan development step, that's step 3. So talking really specifically about academic skills, we might have, again, kind of related to that core phonics outline, these things like reading and connected text, blending, letter sounds and letter names, and thinking about that instructional hierarchy. So when we're doing these initial assessments, these diagnostic assessments, we might need more data. So these are just some examples. I know MTSS in education is full of alphabet soup. So just to kind of give a quick overview, LNF, letter naming fluency, is an assessment that's related to Acadience or Dibbles, is where a lot of these assessments are from. Nonsense word fluency, correct letter sounds, is that NWF-CLS. WWR means whole words read from that nonsense word fluency, and then oral reading fluency, accuracy, and words correct down at the bottom. So being in mind of where these students are. And that helps us link an appropriate intervention. So for example, if we are doing diagnostic assessment of somebody who on these broad composites say, hey, there's a problem, we might have to do oral reading fluency, drilling down. We might have to go down to a skill like blending, even for an older student, because a more well-matched intervention might be something like say it, move it intervention for accuracy problems in blending. Even though they're older in 4th or 5th grade, we need to address those key targeted skills by going back and filling in those gaps. And when I'm talking about interventions, I'm really talking about something very specific. I'm not talking about passing through the threshold of a door to a support room and that's the intervention. What I'm talking about is systemic and explicit steps to remediate a skill or prevent problem behavior for these areas. Interventions are completed in planned specific times and targeted the skill. Interventions take time, so they're not a one and done approach. They need to be done consistently. And the purpose is to remediate or prevent deficits. They don't necessarily solve all problems. So sometimes we might have to work on one skill and then when we're done, move up to the next. Very appropriate with like academic skills and reading. We might start off on working and supporting those gaps in blending, but we still need to keep working and moving the needle. And when they've had success, we focus on the next step, which might be more of that reading and connected text. And when we build fluency there, that's when we might start talking more about comprehension skills. And some notes about implementing interventions. Generally, they're provided individually or in a small group. You can do what's called a standard protocol intervention at tier 2, and that's where this can be done individually or in small groups. They need to have clearly defined procedures, duration, and frequency of implementation, or how often they need to be done. Just kind of a general rule of thumb, thinking back on all the fun articles I've had to read in the last 10 years, if you're not doing intervention at least 3 to 4 times a week, you're really not going to be seeing the level of improvement that the literature kind of talks about. So you have to really intentionally and thoughtfully plan how this gets integrated throughout a school day. Interventions also need to be progress monitored. This really helps teams, especially tier 2 and tier 3 teams, make decisions using data that's not that hard on the sleeve cardiac decision. It's a lot easier to say, hey, across 4 to 6 weeks, like this person's made a lot of progress. We can fade out that behavior intervention, or we can work on the next skill for academics. If we just kind of give it like a thumb, like kind of look, we might not really be addressing the issues as thoroughly or thoughtfully as we should. And then also be in mind, always think of documentation. So I like to have a lot of different sayings. Sometimes a saying could be data or it didn't happen, you might hear sometimes. I'd like to also add another one, documentation or it doesn't happen. And that includes things like follow through. If people don't know what the plan is supposed to be, they're likely not going to follow through on the plan. So just keeping that in mind when you're thinking about selecting interventions and what those look like. So just for an example, going back to that Acadience, Dibbles, you might have a student that flags for these concerns related to like the overall composite. They are not at benchmark. So we might have to go back. We might have to do some oral reading fluency probes. Let's say they're in the 3rd grade. We might have to do 3rd grade, 2nd grade, 1st grade, go back and maybe even approach blending skills. The student might do really well at blending, but have some difficulty with oral reading fluency. So we would logically select a repeated readings intervention for that student. We don't have to work on those foundational skills. We might not be at grade level, but we need to find the instructional level to work at, and we do that through diagnostic assessment. For those that aren't familiar with repeated readings as an intervention, I do have just a couple of brief slides kind of explaining. So repeated readings is an evidence-based intervention to help improve oral reading fluency. It's best utilized for students who have that foundational word skills. So again, following that table, this is not for somebody with an accuracy issue. This is somebody that has a fluency issue. The effectiveness really lies in structured, repetitive practice with error correction and feedback that helps build that automaticity. Because when you build that automaticity over time, it just makes it that much easier for people to read and connected text, which then if you start generalizing that to our different assignments throughout the day for math or social studies or history, makes it a lot more easier to engage in the content when we don't have to worry about the automaticity, how fast somebody can read and kind of understand and process that information. Repeated readings is an intervention that can be used individually as a standard protocol. It can even be done in groups. It can be done in a classroom. It can be delivered peer-to-peer if you have some older students. Passages shouldn't be, passages should be at the student's instructional level. So like I said, we might have to go back 3rd grade, 2nd grade, 1st grade. We might need to be working on 1st grade passages to start. We don't want to give somebody something they're frustrational in, because then that's going to build up that likelihood that it's going to turn into a won't do in the future. For repeated readings specifically, passages should be about 50 to 200 words. We're not asking somebody to read a novel with this intervention. And it's also important to think about what students like. If we read a really boring passage that we don't really care about, it's going to be a lot different in terms of student engagement and really wanting to like participate in this intervention if we have text related to their interests. And there are tons of great examples all across the internet that you can find in various ways. And a lot of materials like with Dibbles, like in their reading probes, like they have a lot of this that's available. Just to kind of give an example for intervention data tracking, because again, I'm a data nerd, always talking about data. Repeated readings keeps track of the number of words kind of on the first trial, talking about a cold read, and the last trial. And that's a way that you can help record this data and make decisions, because then you kind of wind up with a graph like this, where over time you're trying to build up that automaticity, how many words correct per minute that student is reading across those reads, and then trying to help answer and understand that question, like with more practice, are they getting fluent? Is it helping out? Or do we need to pick another intervention? Again, those data decision rules we're trying to think about. So I know I really like my job. I like talking about MTSS even more. Oop, there it goes, there it progresses. Just kind of open up to see if there's any just general questions. I will say I might not have the answer for you in time, but I will try my best to answer. But I figured I would just kind of stop sharing and open it up.
All right. I'll leave the chat open for another minute or so. I have added the SPDEG Linktree link into the chat. This link will get you to all things SPDEG, all of our links for our community of practices, our presentations, our conference registrations. So please be sure to use that. Yes, Rachel, can you come off mic, or do you just, I see you're typing. I was going to say that also Benjamin will post a copy of this recording that it goes along with our OSDE Connect course, which is MTSS Implementation Year 1. So if you're interested in that course, please head over to OSD Connect and look up MTSS. Benjamin, it says her mic and video is disabled, but she's still typing.
Give me 1 second.
Okay.
It should be fixed now.
Okay, can you hear me?
We can.
Okay, hi. I had a question just about assessing a student to see where they're at and what kind of interventions they need. One of my students, so when I'm trying to assess him, it is very hard to get an answer out of him. And a lot of times he just repeats what I say. So if I say, what letter is this? He will repeat that. What letter is this? I've given him options before, like I'll put out A, B, C, and I will say, show me B, and he still repeats that. So it's just very hard to assess him. I've tried to do like a drag and drop game where he can drag it on the iPad and put it in there. But when I show him that, he just does what I do, like almost like he's repeating me no matter what I do. Do you have any ideas?
So just kind of thinking like trying those different modalities is a really great start. But again, like this is that hard part where it just depends. I like not knowing the context of an individual student. I don't really have like a really clear thing. If anybody else has any recommendations, that would be really good. But I think you're doing a lot of what you can. I would highly recommend, if you haven't already, looping in your school psychologist or somebody else to kind of help with this circumstance or situation, because it seems like this might be a little bit more intensive a difficulty than kind of the scope of what I'm talking about.
All right, thank you, Rachel, and I will work on getting you some resources for that. All right, I'm not seeing any other questions at this time. Like I mentioned before, you will be able to get a copy of this recording and go to the link tree to get all things SPDEG. We won't be having a community of practice in December because of the holidays and the busy month. So look for us back here in the last Wednesday in January. We'll see you then. Thank you again, Chase. We appreciate your time. Bye-bye.